I was diagnosed with breast cancer, having chemotherapy. I had surgery in September, therapeutic mammoplasty, and I'm due to start radiotherapy this week. So obviously I lost my hair. I did actually get my children involved. They helped to shave it off. Tamoxifen. Yeah, I do sing a lot. Freedom. I let go of all my limitations, dispossess myself of all the weight associated with things, people, places, public opinion, fears and desires. I fly.
First of all, we're going to do some kinesiology. When you were diagnosed, trauma stored in your body?
Unfairness of it all.
Just focus on my palms. This amazing, resilient, confident lady that is capable and strong and can do anything you want to do. Help correct any misalignment in the spine, etc. at that point. Instilling strength and health. Hello Harmonies, introducing Emma, who has come for a mix of core therapy and maybe some smudging, maybe abdominal massage. And I'm thinking today we might do some NLP, which is Neuro Linguistic programming, and it's a little technique I do to help release trauma that might be stored in the body. You might not have any in the body, so we might not need to do it, but I'll test first. So a little bit of backstory, Emma. What's brought you here today?
Okay, so I was diagnosed with breast cancer in March last year. It's been pretty traumatic. Being diagnosed at 40 is quite surprising, and I wasn't expecting the diagnosis on the day that I went to the breast clinic.
Oh.
So yeah, it was full on from the start, and then within a couple of weeks I was having chemotherapy.
Oh gosh.
So yeah, I had that throughout the summer, and then I had surgery in September to remove the cancerous area. I was told afterwards that the chemotherapy had been successful and it had removed pretty much everything, and then obviously the surgery got rid of the rest. And I'm due to start radiotherapy this week. So this is the final hurdle for me, just to sort of mop up anything that might be left there, microscopic cells and stuff. So
it seems these days, this is in the UK, that they're not just doing chemotherapy on its own now, they always surround it with radiotherapy as well. Would you say that's right now?
Yeah, because I've sort of connected with various people through Facebook who've been going through similar things. Yeah, and most people have had the whole lot.
Right.
So
okay.
It's a long process, but it seems to do the trick.
Okay. And did the chemotherapy make you quite poorly?
Yes. Yeah. So obviously I lost my hair. That was quite traumatic. Well, it's kind of your identity, I think. And it came out really quickly.
Did it?
Within, I think, 11 days after starting chemo. So it was, you know,
really
quite a sort of thing to kind of have to get to grips with pretty quickly. So I did actually get my children involved, and they helped to shave it off for me.
Really?
Because I thought that if they were involved with it, it wouldn't be as bad for them, like for them to come home from school one day and I've shaved my head.
Okay, yeah.
So that was quite nice, and I think they quite enjoyed doing it.
Oh, you made it fun.
Yeah, yeah.
Just remind me, your children are what ages?
8 and 10.
Yeah. So,
and they've been brilliant.
Oh, little kids.
Yeah.
Oh, bless them. So they had good fun helping you shave your head.
Yeah.
And how have they been with you since?
Fantastic.
Really?
Yeah. I mean, they did stay with their dad straight after chemotherapy for sort of about a week. So, and occasionally they'd pop round sort of after school and stuff, but they didn't really see me at my worst.
Oh, okay.
So I think I kind of protected them a little bit.
You needed to be on your own, do you think?
Yeah, I had my mum and my best friend as well. They were sort of looking after me and doing everything for me, and it's been, you know, they've been wonderful. So,
Aww.
yeah.
Oh, cherubs, you know, that gives us heart as well, doesn't it? Makes you feel better. When you had your surgery for the breast cancer, it was a lumpectomy, was it?
Therapeutic mammoplasty.
Yeah, just explain that.
They removed the cancerous area and then I got a breast reduction.
Okay, right. So, and they've removed some lymph nodes under the armpit as well?
Yeah, I think 2 lymph nodes and they were both fine.
They were?
Yeah.
Good, okay. And have they yet done any more scans with you to see if the cancer had spread anywhere else?
I did have a CT scan. I think they go on the basis that the last scan was okay.
Right.
And the radiotherapy will get rid of anything left.
Okay, yeah. And are you taking any medication alongside this?
Yeah, it's tamoxifen. So I've got to take that for, I think it's 5 years. And as far as I'm aware, that's sort of like a hormone blocker because the cancer was estrogen based.
Yeah,
so I think I've been okay side effect wise, so I don't think I haven't been on it for that long, but I think I seem to be okay on it. So.
Wonderful.
Yeah.
Good.
So I'm happy to continue to take it for however long.
So a couple of little things you've touched on. How are you coping being a single mum with this diagnosis, 2 children at home, and you work as well, don't you?
I haven't been working since my diagnosis, but I think the children keep me going. That, you know, I could have quite easily
collapsed.
Yeah. If I was on my own completely, because I still have to get up and do the school run. Yeah. Pick them up from school, even though sometimes after I've done the school run, I have a sleep.
Yeah, good. That's what you need to do.
Yeah. So, and like I said, I've got really good support around me. So
lots of friends.
Yeah.
Great, and a good family.
Yeah.
Lovely. Okay, so anything else I need to be aware of today? How's your sleep?
Sleep generally is okay, and I do have the odd night where it's early hours of the morning I go to sleep. And whether that's just my brain in a bit of overdrive, I don't know, but most likely. My mood isn't great all the time. I take sertraline for that and for anxiety as well. I've been on that for quite some time.
Okay, well, I applaud you for coming to me, because you didn't know me before we were doing these treatments, so you know me through your mum, your lovely mum, and also if you do have anxiety, for being on film as well. I mean, incredible, so thank you, and I'm sure everyone will really give you a big clap and applaud you for that, so yeah, deep respect. So any other symptoms, side effects, aches and pains, issues I need to know about?
Yeah, aches and pains. The injections and chemotherapy initially caused quite a lot of bone ache, and I've just sort of been left a bit.
You've still got that feeling?
Yeah, a bit, and sort of my knees and my back, and I've had a back surgery as well, so yeah, I feel about 106 at the moment. But.
Well, you look great, and your hair coming back as well, your skin looks good. Yeah. So yeah, we're going to do all sorts of things in this treatment. Let's see what comes out. This is your 3rd treatment, so you've had 2 over the last 2 weeks. Have you had any improvements? How have you felt after your treatments?
Straight after it, I feel lovely. Although it's not sort of necessarily relaxing all the time, it still does help with well-being after the treatment. Yeah, I think general improvement just in those couple of treatments.
Yeah, so. And that will have an accumulation effect. So hopefully each time you feel even better than the time before. So I have these lovely cards here. If you'd like to have a little delve and turn one over.
Oh.
Yeah, it's all right.
Let's try not to look. Freedom.
All right. I haven't got my glasses on. Can you read that?
I let go of all my limitations, dispossess myself of all the weight associated with things, people, places, public opinion, fears and desires. I fly.
Oh, are, do you know, freedom is something we all want in our lives. Who doesn't want freedom? And you might see someone down the street and think, if anyone is free, that person looks free. But actually, all of us need freedom. And I do a lot of meditation, and I'm doing another meditation chakra Dharanam course at the moment. And the Vishuddhi chakra, which is the throat area, is all about freedom. So sometimes we need freedom in our vocalizing, so in expressing ourselves, in being able to say things we want to say to other people, or even to ourselves, you know, that internal dialogue, or even singing and shouting, or just being able to be free with the throat. And this is a blue area, so it's really good to help the Vishuddhi chakra is to wear a blue scarf, a blue jumper, blue necklace, blue earrings, anything around the throat, and to sing. So maybe some people might be a little bit self-conscious singing, but if you're in the car on your own and a favourite song comes on, get the windows down and scream and shout and sing your favourite song. Even if you don't know the words, just make them up.
Yeah, I do sing a lot.
Do you?
Not well, but
no. So long as you sing, then your body, because actually it's a vibration in the body when that happens. So that vibration and that humming is very loud in the head. If you were to sing or hum with your fingers over your ears, then you'll get some idea of how much vibration there is through the whole body when you are talking, singing, making a noise. And that resonance, that very small constant vibration, is really good for us. Yeah. So I haven't picked one this week yet, so I've just picked openness. She grabs her glasses. Openness means, as a master, I am so in tune with myself and my conscience is clear. I can be totally and fearlessly open with you, and you can do the same with me. Openness. Yeah. So we're free and open. I'm going to leave those on the windowsill so that they resonate that energy all week, for you, for me, for everyone who comes in here. So your word this week is freedom.
Lovely.
Right, if you would like to lie on the couch. So, first of all, we're going to do some kinesiology. So, can you raise your arm nice and straight? I'm going to push here at your wrist, you're going to hold it up and hold. Nice. And the other one, and hold. Good. And a leg, I'm going to push here and hold. Wonderful. And the same this side, and hold. Good, okay. So, the last twice you've been, and I've commented on it, I've noticed with the kinesiology that there's quite a shake to your limbs. Your arms have far less shake today. You noticed?
Yeah, I noticed.
Yeah. Your legs are still a shake, but it's less than it was. It was quite significant the first and then the second time. So that's good, because when there's like an intrinsic and internal shake in the body, it means that the central structure, so the pelvis and the neck, the spine, isn't aligned correctly, and it's not supporting you to be strong and to be able to raise your arm or leg straight with strength. Now that's coming good, I think things are aligning, and that's only going to be good for your health, alignment. So let's do some tests. Can I have an arm and leg at the same time and hold? Okay, same this side and hold. Okay, so the shake is there. I'm almost going to ignore it at the moment because I've noticed that you're weaker on the left side compared to the right side. You notice that? Yeah. So I'm just going to have a little feel behind your hip on your left, and then relax down. And I'm just going to have a little feel. Ooh, have I found it?
Yeah.
So I'm just feeling the side of your upper sacrum. And then we're going to retest your left arm and leg together and hold. So much better. So basically I'm having a conversation with your body, with your subconscious. I'm not asking you, because if I was to say to you, what's the root of what's making you weak? you'd say, I don't know, that's your job. So I'm asking your subconscious. So I'm saying, right, what's this like? And it's saying, no, I'm not good. So I'm saying, okay, is the root of the problem here? And I'm touching it for a few seconds. And then I'm coming back and saying, right, have I got the right place? And your body's saying yes. So it's like a conversation where it's confirming for me, yes, you got the right place. Do some work there during this treatment. Right, I'm going to carry on. Can I have this arm and this leg this time? Yeah, and hold. Not bad, Emma, brilliant. And the other sides, and hold. Okay, a bit weaker.
Yeah.
Do you notice the difference? You're starting to notice, that's really good. Okay, just feeling your right shoulder. Can you raise this arm up for me and hold? Okay. Not surprising, the shoulder, that's the shoulder of the breast, if you like. It's, you know, with the armpit and everything. Yeah. I think this shoulder might be affected because that was quite weak. Let me just have a feel for your elbow. And arm up and hold. Yeah, okay, we might have a few here. Same again. And hold. Good. Feeling the left hip. And arm up again and hold. Okay, and I'm anchoring you every time I find a weakness. And hold. Good. And when I say the word weakness, you know, I think we have this thing about being weak. And hold. We don't like the word, and we try and refuse it as much as possible, like, no, I'm not weak and I'm strong. But actually, with core therapy and kinesiology, I'm looking for anything that is weak in order that I can treat it and get it strong. So by revealing a weakness, not that you're doing it on purpose, you're trying to be as strong as you can, it's my observation of the body that I can then get on and put it in my shopping list of things to sort out with you.
Yeah.
Yeah. Right, let's have a look at some NLP, Neuro-Linguistic Programming. So, just want to have a think about when you were diagnosed and what you think psychologically, emotionally, might have been behind those feelings at the time and how you felt. Yeah?
Yeah.
Are you all right with this?
Yep.
Yeah, okay. Can you bend your elbow and give me a little finger and thumb? So don't think about what I've just said for now, okay? Think about how spruced up this bothy is because I've had it spring cleaned and how
lovely.
shiny, sparkly clean it is. Okay, so these together nice and firm and hold. Okay, so I'm pulling quite firmly, but you're nice and strong there. So that's my baseline. That's what I'm going to compare against. So when you were diagnosed, think back to how you felt, whether you feel there was any trauma stored in your body from that occasion. Okay, so you're thinking about it now and hold. Yeah. So no, I didn't actually pull as strongly, but yeah. So I was having a feeling that might be stored in you, and I haven't asked you actually, but do you think at the moment that's the trauma that might be stored in you that's shouting the loudest? Or are there other things?
Maybe.
Yeah. Okay. Right, scrub that then. If you don't have to say what it is, I mean you can if you want, but you don't have to say anything about it with this NLP. So if there's something shouting louder, are you thinking of one thing?
So I'm kind of thinking of just the unfairness of it all.
Okay.
It was just pure bad luck that I got it. It wasn't like I didn't have a genetic link for it.
Okay.
You know, it's just one of those things, but it's not a nice thing, and it's you know, yeah, unfair. It
is. So I know through my work and through having spoken to many therapists and oncology practitioners, because I used to work in a hospice, that sometimes breast cancer can be linked to having a blow to the heart. Obviously, it's all the same area, and obviously I study the chakras quite a lot. So the heart chakra right here, and when we feel that we have been hurt, it can potentially come out as breast cancer. So would that make sense to you? Yeah? Is it to do with being a single parent? Yeah, okay. So if you want to think now about what you've just said about the unfairness of it, and with the timing with that potentially, and then the diagnosis of the breast cancer. Yeah? So just give me a little finger and thumb and hold. Yeah, okay, so that was even weaker. So we're going to do some EID now, if that's all right. It only take a minute. It's really quick and it's really good. So I'd like you to keep your head dead center, and I'd like, with your eyes, just to look top left, yeah? And then give me this little finger and thumb again, and hold. Okay, so that opened. If you could look middle left, about over here, and hold. Okay. If you could look bottom left, and then little finger and thumb, and hold. Okay. If you could look, I'm going to come around so I'm not standing in your vision. If you could look bottom right, and hold. Oh, strong. If you could look middle right, and hold. And top right, and hold. Hey, really interesting. So before we carry on, I'm just going to explain what those 6 places mean. So when we look in different areas, those sort of 6 places, it's like gleaning information from filing cabinets that are kept in those 6 locations of our eyes. And so the police and investigative procedures use this, and colleges, universities, and it's all about where we look is getting different information from either our memory or our imagination. So memory is something that's definitely happened. So if we're looking over to our left, we're gleaning information of what we saw, what we heard, and then at the bottom is inner voices, like inner dialogue. This way, to your right, is what we imagine we see. So for instance, if I was to say, imagine the most amazing castle you could ever live in, and you'd describe what the best castle would be. So that would be completely in your imagination. Or when we lie, we're using imagination, because it's not something that has happened or that we saw. And then to the side is what we think we hear, or sound or voices. And then at the bottom is our emotions and feelings. Okay, so you passed all of these right ones. Yeah, so there's nothing to do with imagination or making things up. It's more to do with what you have heard, seen, and an inner dialogue. Okay, so that's what we're going to work on now. Okay, so I am going to put my palms next to each other, but fairly close to your eyes, so they may well be distorted, they may well be blurry, but that's the point. And I'm going to move my hands, but you're going to keep your head dead center again and just move your eyes like you did before. And I'm going to ask you to think about things while I'm doing it. It's only going to be a few seconds to a minute, and then it's done. Okay, are you okay?
Yep.
Yeah. So just focus on my palms, and I want you to see how you were at the time of your diagnosis, and see yourself at that time. See how you felt with the unfairness. And now I want you to hear any conversations, any sounds, noises and voices. take yourself back to that time. Bring it all together. What you saw and heard. Gone. We all right? Okay, so bending your elbow again, little finger and thumb, head in the center, just looking top left and hold. And I'm really pulling, that's awesome. Middle left and hold. Brilliant. And bottom left and hold. Hey! And I'm really pulling as well. Yeah. You're just so much stronger. You do have a shake there, but as I say at the start, I think it's to do with your structure. So you're passing all 6 now, so that's awesome. Now, if you think at another time that you come that there's something else you want to visit, not just what I talked about just then with the diagnosis and feeling unfair, if there's anything else, we can address it again. And if you think that even that one may have come back to haunt you a little bit, we can address it again. Having said that, your body is telling me it's gone. So it's not stored in the liver, the chest, the heart, the kidneys, wherever it might have been lurking. It's now gone from you. And that doesn't mean to say it didn't happen. You know, we're still acknowledging we had these feelings, but you've surpassed it. You're a phoenix rising up from the ashes, and you've just this amazing, resilient, confident, freedom lady that is capable and strong and can do anything you want to do.
Lovely.
Yeah, that's you, Emma. Let's turn you over and give you a little bit of Tuina now.
Yeah.
Okay, so just giving you a little bit of Tuina. So you're comfortable lying on your chest despite the surgery, and you haven't got pains when you lie on your front, no?
No.
Good, good. So I'm feeling that the spine is quite tight here. You can probably feel that, yeah? I don't want to push too much because of you're just about to start some radiotherapy and you've had obviously the course of chemo. So I am being quite gentle on the spine. Once you've finished your radiotherapy, and whether you're having any more scans or tests or whatever, but once you're out at the end of all of the actual treatment you're having, I'll be able to apply a little bit more pressure and help correct any misalignment in the spine, etc. at that point. But for now, I'm trying to instill more relaxation and softening of the muscles, so you're not suffering with any muscle spasms or contortions that's pulling your spine around. Working on the kidneys a little bit here, which will help with your support. Kidneys in Chinese medicine are all to do with the feeling of fear. So the more that we can massage, exercise, soften and give water to our kidneys, the more that we will rise up from any feelings of fear. And of course, fear is underpinning anxiety. That's, in fact, fear underpins a lot of our negative feelings, but anxiety is quite a biggie with the kidneys. So just helping you to feel resilient and strong. Using my thenar muscle, the base, the heel of the hand, against the spine, against this bulking of the upper spine here, with some strong fascia around T1, 2, 3, 4. This will also be affecting your lungs down at T5 and 6. So this, by freeing up this part of the spine here, upper back, that really helps us breathe more fully, more freely. It helps us take deeper breaths. And we find that we breathe deeper more naturally rather than having to remind ourselves to. And then just coming on the soft fascia, away from the spine, down the shoulder length, out the back in between the spine and the scapula, lovely soft tissue here. And then on the scapula itself. How's it feeling, Emma?
Nice.
Oh, good. And then down to the sides of the body, the obliques, waist, and the upper hip, around the side of the sacrum. Oh, is that sore there?
Yes, a little bit.
About here?
Yeah.
Whoa, sorry. Yes. Yes, okay, so that was the point that I tested earlier, and I did what's known as the IPSI test, which is a one side of the body test, and it was, I'm not going to touch it again, but it was about here that was out of alignment. That's why it's sore. So I'm just trying to support the whole area of that misalignment so that the muscles can best support and bring into alignment that separation there. It's called a sacroiliac separation, where the edge of the sacrum and all the ligaments binding the sacrum to the iliac, the hip bone, have slightly come apart. They may have twisted slightly or dropped on one side or been pushed up, and by doing this Tuina Chinese massage all around the area, trying not to inflict too much pain, then these muscles and the circulation, because I can feel the warmth really descending down here now, will help heal and help realign and bind that sacrum to the iliac. Just feeling the spine itself, giving it a little bounce. Lovely. So what I'm doing is I'm pressing on the spine itself, on the side of it, in order to bounce it left to right. And I'm looking at the whole spine, including the hips, when I'm doing this. And I'm hoping, and it's happening, that the spine has a wave-like movement. It should feel good when this happens, apart from when I press on a particular point of where the spine is quite blocked and static. It needs to be quite fluid, and the more that this is done, the more that we can infuse some fluidity to the vertebra, the whole spine, down to the hips and up into the neck. The same again, pushing that shoulder point down, pressing flat palms onto the scapula and around the edge of the scapula using rows of fingers. Encouraging the blood, warmth, and therefore healing to the area. Lovely, and a nice bounce with the hips as I'm pressing on the mid-back, coming all the way down the thoracics. I can feel certain areas that are tighter than others. So coming down to the right kidney point, which is just above the waist. The right one is slightly lower than the left because of the large liver above it. And with any cancer diagnosis, I'm always careful just to treat very carefully, very gingerly, with plenty of compassion, always lots of listening, finding out exactly what the body is telling me, but also what the person has to say. I want to know their story, I want to know what's going on in their lives, and if there's any other support I can give. Not just on the day, but with help between, with lots of advice for home, things that they can be doing. For instance, some yoga and movement at home, some meditation to help support the mind, some affirmations. Some nice movement and nice and warm. Okay, so I'm just going to do a wing stretch in order to help this shoulder girdle. It was actually the other shoulder that was particularly sore. Just letting that go, that's it. That's it, lovely, nice, good shoulder movement, nice and fluid. And same this side. Let's see if it acts differently. Lovely, well done. So I'm just holding the edge of the scapula with a row of fingers, pulling it away, just gently encouraging it out. Good. Freeing up the foot, and in so doing also freeing up the body with the reflex meridians. Good, lovely. A little bit of leg repatterning to realign the pelvis and down. Good. And I'm just looking at the pelvis while doing this. Setting the pelvis back level again, so it's nice and balanced, and down. And a nice sacral float, which is so important in any treatment. So, double-handed palms, connecting with the energy of the sacrum, rocking of the bone, where the cerebral spinal fluid connects through and back up again, all around the brain and back down the spine. The circulation, the lymph is so key here for the inguinal lymph factory. And of course all the ligaments connecting the sacrum to the rest of the pelvis, and then all the organs contained within the pelvic structure. Digestive, excretory, reproductive, lymph, circulatory, urinary, smooth, lovely. Getting rid of that shake. It's going, it's going, it's going. Connecting the occiput to the sacrum, feeling cerebral spinal fluid circulate from one hand to the other. Finding peace. Beautiful. I can feel the body settling and calming. Really good. Okay, in your own time, Emma, if you'd like to turn over nice and gently. Would you like a warm towel over you? Are you feeling chilly?
Yeah, that'd be nice.
Yeah. Nice, isn't it? So I'm just going to do some smudging, which we've done before, I think. Oh, it smells lovely. So burning a beautiful bundle of sage, and sage has been used for hundreds of years to help remove impurities. So illness and disease, negative thoughts, old mannerisms, characteristics, things we hang on to that do not serve us. Removing, just opening the window to help them leave us, go out the window. Lovely. Right, get that window shut. it with my hands here, yeah. So I just want you to close your eyes and take a few deep breaths. And now I'd like you to affirm, I am strong and healthy several times.
I am strong and healthy. I am strong and healthy. I am strong and healthy.
Wonderful. And now feel those words surrounding you, swimming around your body, infusing through you, and in your mind's eye, sending those words deep inside you, strong and healthy, to any part that you feel needs a little help. And see the words, the intention, the meaning of those words landing within you, settling, instilling strength and health, alongside the manner in which they settle, which is at peace and with calm. A beautiful, tranquil feeling of strength and health. And then the energy of those words spreads. You may see it with a certain tone or a colour or an embodiment, be it as like a steam or a smoke or a whoosh of air or wind, rays of sun. See the words settling and living within you throughout your body. Just going to do a little bit of Qigong with your neck. I'm going to go very gently because it's quite a sensitive area. Just going to raise up slightly underneath the occiput at the top of C1, letting the head go heavy, 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 settling it down into the cushion, into my hands, feeling the energy of Qigong, a beautiful, profound resonance. Beautiful. And then to the temporal. Instilling an energy of calm and tranquility deeply within the mind, and therefore the whole body. is strong and healthy. My mind is calm. Okay, keeping your eyes closed, taking some nice long breaths. Feeling the breath, that energy, vibration, that resonance powering through you as you inhale. Feeling the breath arrive at feet and fingers. Feeling palms and soles tingle slightly with the breath arriving. And then when you feel like it, just slowly bringing in some movement to toes, hands and fingers. I'm just going to remove the towel. And then turning into ankles and wrists. And then turning into shoulders, maybe one direction, and then the other. Okay, and then if you feel like it, arms up over your head for a nice whole body stretch. Okay. So I'm just going to retest two things.
Okay.
Can I have your left arm and your left leg together and hold? Okay, it's going down slightly. The shake is a little bit better, i.e. it's not there so much. I'll just put this under your knees. Yeah. And now I want your right arm and left leg together and hold. Oh, that's a lot better. Okay, so that one was telling me that you had some joints that weren't happy, particularly the right shoulder, but I'm thinking that's a lot better now. That test was really good. And obviously we've already retested the NLP ones of the left side when you were looking at the left side with your eyes. So I'm hoping you'll feel better because that's out of you as well. So good. How are you feeling, Emma?
Lovely.
You feel in a nice place?
Yes. Yeah, nice and relaxed.
Oh, good. Lovely.